Welcome everyone to Explore Veterinary Day. We are here with Dr. Bruce at the Garner Vet Clinic. We're going to get a little tour of the clinic and he's going to tell us all about what it's like to be a vet. So thanks for having us, Dr. Bruce.
Thank you. Welcome to all the kids.
Where are we at right now?
So we're in the main reception area and retail area of the clinic. This is Liz, who's our front desk receptionist and handles all the checkout and check-in duties for our pets as they come in for their appointment. And then this is the different shampoos and medicines and different things that we have available for sale. Food for our dogs, treats.
So tell us about some of the things we see over here and what they're for.
So we have on the top shelf where you're at, these are flea and tick products, some flea and tick tablets, as well as liquid that goes on the back to help prevent and control fleas and ticks on our pets, dogs and cats. The second shelf is some shampoos, some milk replacer for kittens and dogs. When they're orphan kittens and dogs, that's milk to feed them. And then here's a hormone that we use for cats to help calm them, the feel away. And then on the bottom shelf there's some different large animal products. Some bovine, some milk replacer for bovines, some electrolytes for bovines, some intestinal parasite wormers for horses, and the one way over here on our right is like an aspirin for horses.
So of all of these products, which ones do you use the most frequently?
It really depends on the day. I guess the top shelf with all this time of year, the flea and tick products, we use a lot of those and recommend a lot of those.
Very good.
We don't want bugs crawling on us, do we?
No, we don't want bugs from our pets. All right, should we follow you back for a tour?
Sure. All right.
Whenever you're ready.
Okay, so this is our main exam room. This is where we bring our patients in with their owner, the dog, cats, lizard, bunnies, birds, ducks, hamsters, guinea pigs, you name it. We've had it in this room to examine them and start the process of trying to figure out what's wrong with them, or routine visits where we'll vaccinate for the different viruses and things that affect both the dog and the cat. And then also another big thing is we got a whole section here on heartworm disease in the dog, which is a disease that's transmitted from dog to dog by a mosquito. So we have a model representing the adult heartworm here, where it grows up in the heart of the dog. Also, this is a real live liver that has heartworms in the liver of a dog, and this is an actual heart of a dog that was infected with heartworms. As you can see, there's the worms kind of where it's been cut, sticking out there.
Tell us about what that does to the dog.
So basically, a mosquito that's been infected or bites a dog that's infected, picks up a worm from that dog. It goes through a life cycle through that mosquito, and then it bites another dog and it injects that worm into that dog, and then that migrates throughout the dog's body and grows up in the heart as an adult worm. And so they get enough of them in there, it can cause congestive heart failure in the dog. So,
and that means that the dog will not be able to survive if that happens.
Not very well, no. And so we have a prevention program that includes a yearly blood test to make sure they're negative, and then there's a monthly tablet we recommend giving to prevent heartworms through the mosquito season.
Very good.
And this is this is a model that represents the the bones of the rear of the dog. And these are some of the conditions that we kind of represented here that we deal with. You can see the hip right here has got arthritis. So that's a condition we routinely deal with.
How do we know that that's arthritis, Dr. Bruce?
Because of the roughness around on the bone and on both bones, the leg bone and this bone. Where on this side, this is a normal hip, and you can tell the difference. It's all smooth and nice and well defined. And also, dogs get back problems, and it's represented on this model by a disc problem in the back of the dog, which can get kind of serious and cause pain, just like your mom and dad get back pain. And we have a machine over here that helps us out with some of these painful situations. This is a laser therapy unit, and we put this one right on the dog's leg, back, or neck, or anywhere, and we push a button, and so laser beams go down through the dog and help us with pain.
Does it work on humans too?
Yes, it does.
Oh, wow. But you probably have to be super trained to do that.
It takes a little bit of training to use the machine.
Okay.
And then, what else do we got here? We got where we have a cabinet, it's not a refrigerator, with medicines we use. We have muzzles on those dogs and cats that aren't so friendly.
What do you do with the muzzle?
We put it around their nose.
So that
they don't bite us.
There we go. We don't want to. You probably don't enjoy getting bit.
No. And then we have a refrigerator here. That's where all our vaccines are for dogs and cats. You know, you get the kittens with the runny eyes and other pneumonia problems, and these are some of the vaccines we use to help with that. Plus, if you ever heard of rabies, this is where the rabies vaccine is, and rabies isn't a good disease.
Okay, good. All right, you want to switch? Now I'm ready.
All right, so here we are in our surgical room, and we perform all kinds of routine surgeries, as well as other surgeries, fixing broken bones, removing stuff out of the inside of dogs, and we'll look at some stuff that we've removed in the past. And this represents how we do our surgeries. We have a monitor where we monitor their breathing and heartbeat there. We have an IV fluids that we put them on during surgery to help support them, so we make sure they wake up. We have a laser surgical unit and a vacuum cleaner that go together, and this helps us cut the body, cut the skin, and we don't end up with as much bleeding. We have a mask with the hose representing our gas anesthesia machine. So this is how we maintain them through anesthesia with gas and oxygen. And we can just shut it off and wake them back up afterwards.
Why do you make them sleepy?
So they don't move. So we can't do surgery, cut on the dog or the cat, and while they're awake.
And do they know it? Do they know if they're sleeping what you're doing?
No, they do not.
All right, so that keeps you safe and them safe, and also helps them not feel as yucky.
Right.
Okay.
And we don't want them moving around while we're doing surgery on them. That could be bad. So this represents a pack of instruments that are sterile inside this pack here, and this is a pack of suture material we use to sew them, to put them back together, and then this is a surgical blade we use to help cut also, along with our surgical laser machine.
Tell us a little bit more about your stuffed dog that he's showing here. We noticed that you got his legs tied. What is that for?
Okay, this dog is in the typical position that we put the dog in when we're going to spay or neuter. And this particular dog, the way the drape is set up, is more in place of a dog that we're going to spay, a female that we're going to make so she can't have puppies anymore. So we put them on this tray to hold them upright like that, and then tie their legs back so their legs aren't in the way.
Does that keep them safe and you safe?
Very much so.
Okay. Because it looks kind of scary, but I'm sure you have a reason for all of that you do, right?
Exactly.
And then when they wake up, they don't even know that their legs were tied up.
No, not at all.
And how do you make sure that they are taken care of when they're in here? Oh, they have a nice little stand there so it doesn't feel as weird under her back. I don't know if you can see that on the camera.
Yeah, the V tray.
There you go.
And then we have two technicians, Kaylee and Perry.
Do we get to meet them? Here they come, I think.
Kaylee and Perry.
Hi, ladies.
Hello.
And
Hi.
while I'm doing surgery, Kaylee and Perry is making sure the dog is breathing, the heartbeat is strong, the IV fluids are running good, and the anesthesia is at an acceptable level.
So it takes a
surgery.
whole team of you guys to make sure that our animals are well taken care of.
Exactly.
Very good. What's the surgery that you do most frequently, Dr. Bruce?
It would be between spay and neutering.
Why would that be important for us to do with our pets?
Because there's plenty of pets out there, plenty of dogs, plenty of cats, and by being responsible by spay neutering our pets, we don't need to add to the overpopulation of dogs and cats throughout the country.
Do you see if somebody gets too many cats that they all get sick?
They can get sick, or they can bother the neighbors, they can just cause various other problems around any given neighborhood.
So this is why the dog is in here in surgery today, is so that we don't end up with too many pets that we can't take care of. Is
Correct.
that right?
Correct.
All right.
Okay, so we were talking about doing surgery and what we do surgery on, why we do surgery. We talked about spay neutering, which are routine elective surgeries. Here's some x-rays, and these x-rays are ones that were taken a few years ago and these would be traditional x-rays you might have seen or your mom and dad might have seen in the doctor's office. So we got a dog with a leg, and you can see it's broken.
There it is. Now we can see that it's broken.
And then we have a bird over here, which I would say this is a normal. There's nothing I can tell you going on with the bird. It's just an x-ray of a bird,
So
and it was normal.
point out to us the broken bone on the dog.
So this is a broke.
And that pointy
Pieces.
part, it shouldn't be pointy, right?
Correct. This whole piece, and
So what do you do for that dog?
various things can be done. We can put a cast on it, which we probably did, or you can take it to an orthopedic surgeon and they can put a pin in it and put screws in there to hold it together.
And that's the same way you would fix a bone on a human, right?
Correct, the exact same way. So moving on. All right. So maybe you can guess what's going on with this dog. So as you can see, there's a big stone inside that dog.
So when it's white, that means it's solid?
Correct.
Is that a rock that the dog would have eaten?
No, that is an actual stone in the urinary bladder.
Like a kidney stone, like a human
Correct,
would get?
correct. So with this, we would have done surgery and removed that from the dog.
It looks pretty big, Dr. Bruce.
It was. Bigger than your marbles, I guess, would be. All right, I'm gonna... Here's another one. You can guess what's going on here. See if you can recognize something familiar inside this dog. Do you recognize something familiar in this dog?
Oh my goodness sakes, can you guys see what that is? Yikes.
So you guys better be careful. If you get too hungry, you might swallow your spoon, like this dog did. So this is a spoon inside the dog's stomach.
How big is this dog?
This would have been, about the size, about a 60-pound dog.
So a little bit smaller than a lab?
Oh, probably roughly the size of a lab.
Okay.
It was an Akita, is what actually the breed of the dog. So it would have been that 60, 70-pound range. So there's a surgery that we had to perform to remove the spoon.
So this dog ate that spoon and it's in his tummy.
Correct. The owner actually tried to give the dog some medicine with the spoon, and things went awry.
Tell us about what else we see in this picture. That the spoon is laying across something that goes all the way down.
So this is a stomach here. The liver's up in this area. This is kind of the small intestine up over here, and then the colon, and this is stool, poop in the colon right there.
And tell us about the spine and the hips that we can kind of see.
So this is the pelvis, the hip. You can't quite see the back legs of the dog. You can somewhat here. And then these are the vertebrae, like we saw in our model.
Mm-hmm.
That's where the discs, in between the vertebrae are the discs that can get painful for a dog.
So is a spine on a dog similar to a spine on us?
Very much.
And then up there, kind of around the spoon, are those the dog's ribs?
Correct. So these are the ribs. There's a couple. The first couple are what they call floating ribs, and then the next few kind of connect to your sternum, to that middle bone you feel in your chest.
Wow, you know a lot.
All right. Let's go with one more x-ray. And you can maybe determine what is going on here. Two different dogs. And you can see this is what the normal hip looks like, unlike our model that showed arthritis. You can see that really smooth and smooth up here. Same with the one over there. So as you look closely here, maybe you can see some little rib bones in the picture here, and maybe some kind of white looking things that maybe look like a head. So these two pictures These were pregnant dogs that were close to giving birth.
So those are the spines of the baby dogs that we can kind of see.
The spines, and then the ribs, and then, like I said, the skull.
Oh, wow.
Skull. This would be probably a skull there.
How many puppies do you think are in there?
I think you probably could safely, there's probably 6 to 8, I would think.
Wow.
Same with both of them, I think. They're two different dogs, but I would say there's probably 6 to 8 between them. And I cannot remember how many they ended up having. Okay, so this is our laboratory room. We have a refrigerator here. We keep vaccine and stuff that so we can stock our vaccine refrigerator exam room. This is a microscope where we look for bugs on animals as well as bugs in animals. We look in the poop and see if we can find eggs from worms, so we can treat the animal for whatever worm that they need to be treated with. And that's dogs, cats, pigs, cattle, sheep, horses. We do stool samples on a wide variety of animals to determine their eggs and worm load they have in their intestine. Here's where we centrifuges, where we prep the blood or prepare the blood samples to be tested. Either we send them out to a laboratory, or we have some machines out here in the other room that we'll look at where we do blood sampling then.
What does that machine do, that centrifuge machine?
What that does is spin around to separate the different parts of the blood.
And then you test different parts for different things that you
Correct.
need.
Different parts of the blood are used for different tests.
All right, good. Tell us about worms. Can humans get worms?
That's one of the most important things we do in veterinary medicine, because there are some worms that can potentially be transmitted from dogs to cats to people. So we want to we want to keep a good handle on keeping our pets free of worms, intestinal worms.
And what happens if they do get those worms in their intestines?
So for the dog and cat that get a worm infection, it can cause them to lose red blood cells. The worms will eat blood, which isn't good. It'll help disrupt the digestion of the dog or cat. Plus, it will eat maybe some valuable nutrients that the dogs and cats need to grow and to live.
And then that just makes them feel sick?
Make them feel sick, or just make them thin where they don't gain the right amount of weight that they should, to get the proper nutrition from the food they eat.
Okay. Good?
Yep.
All right, ready.
So here we have the blood machines we talked about. This machine will check how many red blood cells, white blood cells you have, how many blood cells you have circulating around in your veins, inside your veins and arteries. This machine will check to make sure that your organs are functioning normal, your kidneys, your liver, if you have diabetes, all of those things.
So can those machines test human blood or animal blood?
Potentially they could test human blood, but
you don't do that here.
no, they're probably not calibrated very well for human blood. They're calibrated for the different species: dog, cat, horse, birds, cattle.
Good?
Yep.
Go for it.
So this is our kennel area where we keep our dogs, cats, and other animals that we're going to be doing surgery on or other treatments, taking an x-ray or doing blood samples, cleaning teeth, any of those things. This is where we keep them so they don't get hurt while they're in our care and stuff. And so they can wake up from anesthesia and they don't hurt themselves and that all that kind of stuff.
And they each have their own cage?
Correct.
So they don't fight or get scared?
No.
Looks like there's a lot of cages in here. Go for it.
So real quick, this is where we do some grooming of dogs, cut their hair, comb them, and particularly we bathe them right here too. So this is our tub for bathing the dogs here in the hospital if they need to be.
Ready whenever you're ready.
Okay, so kind of the last part of our tour here, we're kind of getting to the back part of the clinic, and this is our x-ray machine where we took the x-rays that we saw earlier on the view boxes, but this is now set up so we can see the x-rays on the computer. So this is the way we look at x-rays now. So what we have here is a duck that we took an x-ray of last week. So he's laying on his back, and you can see some gravel, and that would be in his, what you would call his gizzard of the duck. So that's all normal. There was nothing abnormal about the duck, but the stones were in the gizzard.
He's supposed to have those to help him with his food.
For his digestion. So the food comes down to the gizzard. It gets broke up by the stones and then passes through the rest of the intestinal tract and out the other end.
Why does he have stones in there?
To help break up the food, the corn, the other grains they eat.
Because ducks don't have teeth, do they?
No.
I'm glad I have teeth instead of stones in my gut.
So the gizzard is a big muscle that has stones that grind up the feed so it can be digested by the rest of the intestinal tract.
So you said that this duck was like that. Are all birds like that?
All birds are like that.
Whoa, that's cool.
And here's a cat. And what this cat has is a lot of poop in the colon. So this is all the colon, the large intestine. As you can see. So we had to work on helping this kitty get all this poop out of him.
It looks like he has a tummy ache.
He did.
Did he eat something bad that made it all get blocked up like that?
No, he has a medical condition that causes his colon his large intestine not to work properly.
Okay, so you have to help him out.
Help him out, and hopefully we have a diet that will help to gain long-term control of the problem.
So you don't have to do that.
So we don't end up with a bunch of poop in the colon.
Yeah.
Okay, as we move through. Okay, this was a little puppy, and I don't know if you can see what's going on here. But this little puppy ate something he shouldn't have ate. Maybe some of you fishermen out there might recognize this. So this is actually a little fishing lure in the colon of this dog. So we had to surgically remove that.
With the hooks on it?
With the hooks.
So did it tear him up?
Nope, he was fine.
That's good. So what are we looking at now?
This is the mouth of a dog that had a broken jaw.
Oh, and that's holding his head open so you can take a good
the
picture.
x-rays, right.
So show us with your hand what we're looking at so the kids can...
So here's a piece of broken bone there.
And the top of his head is where?
This is his top of his skull, his ears.
So his nose is up on the right corner.
Right.
And then do we also see his neck?
So this is his cervical vertebrae, his neck vertebrae.
I think we might have to have you use your hand instead of the mouse so we can see it.
So the cervical vertebrae, just like in people, we got 1, 2, 3, 4, 5. And then this is seven cervical vertebrae. And then the skull. And then you can see the teeth and that kind of thing. This is a tube that we have him under anesthesia. So that tube is delivering oxygen as well as gas to keep him under anesthesia to so we can take these x-rays of his mouth.
Okay.
Then here again, you can maybe see some bones, some little rib bones, a skull. So this puppy, so there's 1, 2, 3, 4, 5. So this puppy had five little puppies, and they were schnauzers. Kind of see him here. So here's another, you can see all the stones that are in the bladder there. They're in the bladder. These are all stones. And we'll go there. You can really see them there. A whole box of rocks. So that puppy couldn't pee very well.
And that, again, like the other one, was not something he ate. It just got built up in his bladder.
Correct. And we can see the liver really well. The liver here. These are the small intestines, some gas in there and stuff. Stomach up in here.
And lots of bones.
And then lastly, so this puppy was, I believe, hit by a car and ended up dislocating the hip bone. You can see this, you can see where this ball is in the socket there, and the femur, and this ball is out of the socket. So we had to surgically come in and remove that ball off the top of that bone.
So you did that here.
Correct.
And you helped that dog. Was he able to walk again?
Yes, he was.
Wow.
They bounced back pretty well from that surgery. So that's the way we do x-rays now in the modern era, in the era of technology.
Are they faster?
A lot faster. Instantaneous. We can take an x-ray and look at it, and if we don't like how it's positioned, we can take another one right away. Instead of before, you took 2 x-rays, you took a cassette, you took it in the back room, and you had to develop it like we saw in the other room on the view box. And if it wasn't quite right, either we didn't do another one or we had to go through a long process again to get it right. Where this is, we can do it right within seconds, minutes.
Good deal. Okay. Thank you. Dr. Dr. Bruce, what an awesome day we've had following you around. If we wanted to become a vet, how would we do that?
Well, you have to start out by going to college. You have to graduate high school, go to college. You have to spend 4 years, 3 to 4 years in what they call an undergrad, pre-studies. And then you have to apply to veterinary school. And once you get in veterinary school, it takes you 4 years in veterinary school. So anywhere from 6 to 8 years of college to become a veterinarian.
Is that the same amount of school you would take to be a doctor?
Correct.
So you know the same thing as doctors, only you know more animals and doctors only know humans.
Correct.
So tell us about, what's your favorite thing to do as a vet?
My favorite thing to do as a vet is to make people happy.
Fixing up their pets?
Fixing up their pets.
And what's the thing that you do most frequently?
Things that we do most frequently is probably preventive care. Vaccinations, heartworm tests, worming animals, providing flea and tick medication, cleaning teeth.
Do you have a favorite animal that you like to work with the most?
Healthy animals.
Do you prefer cats, dogs, cattle?
I have no preference. It just depends on the day.
It depends on
It's nice to go outside and work on cattle, but it's also nice to be inside and work on dogs and cats too.
All right. Thank you, Dr. Bruce, for a great tour.
Thank you, boys and girls, for allowing me to help educate you on our clinic here at Garner Veterinary Clinic.